start for housekeeping purposes with your first and last name and your title.
All right, I'm Dr. Travis Nick. I'm the Medical Director of Scottsdale Ranch Animal Hospital and Regional Medical Director for Pet Vet Care Centers.
So we're talking about valley fever today. We're expecting some dust to move through tonight. We've seen it during monsoon season. What can you tell us about what people need to know for their four-legged friends that are outside in the environment and the risk that they face?
So valley fever is a fungal disease. It's endemic here in the Southwest from California over to Texas, but especially common here in Arizona. Times at which the soil is disturbed is when it's potentially its most infectious. So if there's high winds or other things that would disturb the soil, like putting a new pool in or some kind of construction in the area, we have to think about valley fever as a potential risk factor. On the other hand, it's endemic in the area, and so really any disturbance of the soil, and dogs are pretty good about doing that on their own too, puts them all potentially at risk to some degree year-round.
What can you tell is going on with your dog, some symptoms that might bring them in for a check-in for that?
So the good news and bad news of valley fever is because it's so endemic, veterinarians in the area are really very familiar with what it looks like. By far the most common presentation is a dog who might have a fever, hence the name, lethargy potentially as well, just not feeling very good. Sometimes they're not eating very well or losing weight. And then the primary form that it takes is a respiratory form, so coughing.
Okay, so a lot of people obviously want to take their animals out, take their dog for a walk, they need to use the restroom, but when something's coming through, do you have specific advice for pet owners as far as like what they should or shouldn't do when it's monsoon season?
Yeah, exactly. If there's blowing dust, it's not a good thing to be out in, and that's true for you and your pets as well. So pretty good rule of thumb is if that's not something that you'd be comfortable walking around in or just being outside in, just be careful with your pets and make sure that they can seek shelter in the same way that you would do for yourself.
Is there any risk, like afterward, when things have gone through, it's not actively blowing around, but it sounds like if your dog's digging around, there's still a risk there?
There's always some risk for valley fever because we all live in an area where it's in our soil. And so when the soil is disturbed, that's when it's at its most risk or highest risk. The daily risk, though, is always there because dogs are dogs and they are scratching around in the dirt and sniffing, and that's normal for their species. That's why they are what's called sentinel species. So they're the number one species that we see valley fever in. They're not all that susceptible, but yeah, we will see it in a lot of them.
And final question, just to calm some nerves, maybe if people are watching this tonight, it's not a death sentence by any means if your dog is diagnosed with
Exactly, yeah, that's the point. So valley fever being endemic is not something that is entirely preventable, but it's very treatable. The vast majority of dogs who are diagnosed promptly and treated correctly with the proper follow-up, they really do great. We diagnose lots and lots of cases of valley fever, and very rarely does it turn into something complicated or difficult to treat. It can happen, but it's not common at all.
Before we look at the x-rays and kind of get an idea of what this might look like, is there anything else that we missed or that you wanted to add?
Well, I'd say that valley fever takes a form different than humans. So some people are familiar with what valley fever looks like, and I have quite a lot of clients who express that they've had valley fever touch them or a family member or something like that. In dogs, it is quite a lot different. In animals, it's different than in humans. Humans get pneumonia and they'll have lung lesions. That's really quite rare in dogs, and I'll show you what it looks like actually in dogs, which is very different than what it takes in humans. And then about 25% of cases in dogs disseminate outside of the respiratory system. So another way that valley fever presents, and this is not very common in other species, is in sites outside of the respiratory tree. So they can have forms that take on neurologic manifestations, ocular manifestations that can go to the bone, and sometimes, and this is especially common in cats, where we do diagnose it in cats, it's more common that it's draining like skin lesions. So it really can look like anything, and that's why when your vet says, hey, valley fever is on my list, that'll be the case for a lot of presentations, and I would just recommend proactive screening is good. I don't recommend screening normal pets for it, on the other hand, because that can be kind of fraught in an endemic area. Lots of animals are exposed, and you don't always want to know, have they been exposed? We really want to know if they have symptoms, are those symptoms compatible with disease, and then the tests are more useful in those scenarios.
Wonderful.
Yeah.
Thanks so much.
Sure.
Let's take a look.
Yeah.
Where do you want me for this? I kind of want to just be out of the way, but I also want.
I can tell you when you're in the way.
Okay. Am I in the way if I'm like right here? I mean, like I can be in it, but I don't want to be blocking anything?
No, you're fine there.
Okay, cool. All right, yeah, so what are we looking at here?
Yeah, so this is a patient who is a very typical x-ray for valley fever. Like I said, in humans, valley fever often takes a form that looks like pneumonia or is a secondary pneumonia, or they'll have lung lesions, small little nodules in their lungs called granulomas. In dogs, that's actually quite rare. It does happen, but this is much more common. So what we're seeing here is a dog. He's presented for coughing. His head is up over this way, and that's his belly. This is his heart right here. And then just above his heart, so this is his windpipe, his trachea. This soft tissue density here, kind of patchy area, that's not supposed to be there. And there are tracheobronchial lymph nodes, so lymph nodes that live right as the windpipe kind of bifurcates into two sides. That really puffy area is almost pathognomonic, almost can't be anything other than valley fever. And then when we see that on x-rays, if we get a coughing dog, may or may not have a fever, may or may not have lethargy, that would be this dog has a 99% chance of having valley fever, and the tests then confirm that for us.
Great.
Yeah.
Awesome. Thank you.
Of course. Yeah, really classic lesions for it.
Yeah, just like right here. And
That whole area, yeah, and this is a across the room,
Sure.
kind of diagnosis. There's luckily not a whole lot else that looks like that.
Yeah, that
Yeah.
makes it easier.
Mhm.
Yeah. Awesome.
Yeah.
Good? Okay.